Hi, this is Tanya Stansel, and we're going to talk about diabetes. First, a disclaimer, this video is solely for educational purposes. It is not meant to diagnose or treat any condition. Diabetes is a metabolic disorder that involves the release of insulin from the pancreas and its use in the body in order to process and store glucose, which is a sugar within the body. Glucose is an important source of energy. However, too much of it can negatively impact health. There are approximately 50.2 million people 18 years or older in the United States with diabetes, either diagnosed or undiagnosed. This equates to almost 10% of the population in the United States. More than 25% do not know that they have diabetes. Types of diabetes include type 1, type 2, gestational, and prediabetes. In type 1 diabetes, an individual's immune system destroys the cells of the pancreas that produce insulin. This greatly reduces the amount of insulin being produced. Without insulin or very little insulin, the amount of blood sugar within the body increases. There is a genetic proponent to type 1 diabetes. Prediabetes is a step to developing type 2 diabetes. In prediabetes, cells within the body become increasingly resistant to insulin. Regardless of how hard the pancreas works, it cannot make enough insulin to counteract the insulin resistance. This leads to blood glucose increasing instead of being used by cells for energy. At this point, someone has developed type 2 diabetes. There is also a genetic aspect to type 2 diabetes. Increased weight is also linked to developing type 2 diabetes. Gestational diabetes occurs during pregnancy and occurs due to hormones being produced by the placenta, causing cells to be resistant to insulin. Typically, type 1 diabetes is diagnosed in children and younger adults, but can be diagnosed at any age. Type 2 diabetes is typically diagnosed in adulthood, but can also be diagnosed in children as well. Again, gestational diabetes is diagnosed during pregnancy. Symptoms of diabetes include extreme hunger, fatigue, increased urination, increased thirst, dry mouth, itchy skin, blurred vision, and impotence or erectile dysfunction. Symptoms of type 1 diabetes could also include unexplained weight loss, nausea, vomiting, velvety dark skin changes of the neck, armpits, and groin called acanthosis nigricans, or decreased vision. Diabetes can play a part in developing conditions such as heart disease, stroke, kidney disease, eye problems, dental disease, nerve disease, foot problems, hearing impairment, Alzheimer's disease, or depression. As with other conditions, there are risk factors for diabetes. For type 1 diabetes, risk factors include family history, environmental factors, presence of damaging immune system cells called autoantibodies, and geography. There are some countries that have increased incidence of type 1 diabetes. For prediabetes and type 2 diabetes, risk factors include family history, weight, physical inactivity, race, age, gestational diabetes, polycystic ovary syndrome, hypertension, and high cholesterol. Risk factors for gestational diabetes include age, family history, personal history, weight, and race. Complications of gestational diabetes can also include excess growth, resulting in a large baby, usually 9 pounds or more, the baby being more likely to develop type 2 diabetes later in life, low blood sugar, or death. There are blood tests that can be used to diagnose diabetes. With type 1 diabetes, Because these symptoms arise very quickly, it is usually warranted to do these blood tests immediately. With prediabetes or type 2 diabetes and gestational diabetes, there are guidelines put forth by the American Diabetic Association that are usually followed. The guidelines include having a BMI greater than 25, regardless of age, being 45 years or older, any woman that has had gestational diabetes during a pregnancy, or having had a diagnosis of prediabetes. The tests for diabetes include glycated hemoglobin A1C test, which can show the blood sugar level over a 3-month period, random blood sugar testing, fasting blood sugar testing, oral glucose tolerance testing, checking urine for ketones, which is usually done with type 1 diabetes, and a glucose challenge test, which can be used to diagnose gestational diabetes. There are treatments used for diabetes. For type 1, insulin is used, either through injections or the use of an insulin pump. Blood sugar checks are done daily, as well as carbohydrate counting. For type 2 diabetes or prediabetes, lifestyle changes need to be made, such as exercise, weight loss, eating a well-balanced diet, and drinking minimal alcohol. Medications can also be taken, such as metformin, SGLT2 inhibitors, and GLP-1 receptor agonists. Bariatric surgery can also be helpful in achieving weight loss. Other conditions include diabetic ketoacidosis and hyperglycemic hyperosmolar non-ketotic syndrome. Diabetic ketoacidosis occurs when cells are starved for energy, which causes the body to break down fat. The breakdown of this fat produces ketones, which are toxic to the body. Symptoms of diabetic ketoacidosis include loss of appetite, weakness, fever, numbness, stomach pain, and a sweet, fruity breath. If you have diabetes or are caring for someone with diabetes, it is important to understand certain conditions as they may constitute an emergency. It is also important to understand the doctor's recommendation for what to do when these conditions occur. One recommendation may be to go to the emergency room. The first two conditions are hypoglycemia and hyperglycemia. Hypoglycemia is when the blood sugar level drops below a target level. Symptoms of hypoglycemia include sweating, shakiness, weakness, hunger, dizziness, headaches, and blurred vision. Hyperglycemia occurs when the blood sugar level rises above a target level. Symptoms of hyperglycemia include frequent urination, increased thirst, dry mouth, blurred vision, fatigue, and nausea. Thank you for watching our video on diabetes. Please subscribe below to our channel and visit our Healthy Living blog at healthylivingforyourself.com for more information on diabetes and other healthy living topics.